We are an academic health department here, and we have been partnering with the local colleges and universities for over 20 years. Even some of the other academic instructors, we already had the partnerships with the schools, but then extra instructors reached out to us and said, hey, we can't get our students in anywhere. Does anybody have any room for them? One of the things with public health nursing and being in the health department, a lot of times it was a lot more observation, but since the pandemic and that we needed extra hands to do things, they did play a huge role.
I think they really liked it. They got to be a part of history, and they were actually, not that they don't make a difference every day, but they were really doing something that got to help us out. We needed their help. We did then hire contact tracers as well at the health department, and some of the students actually liked it so much that they applied to be one of our contact tracers. Now we even have a couple that are employees.
The biggest thing is that our relationships with those academic partners, they are much stronger than they were. They know that we're here for them. They were here for us. We talk on a regular basis. They're excited to help us. They know that their students are going to get a good experience when they come here. And we just really have worked very well together. And they are excited to see the progress with it. So they're apt to send their students to us, and they want to continue to work together with us. And they know too how important it was for the students to actually feel like a part and that they got to do things that really mattered. Sometimes clinicals are really tough like that because, again, in the health department, sometimes it's a lot more observational, but this really increased the quality of our relationship.
Having consistency with COVID, things were always changing, and just being able to adapt to the change. Also, with the students, it was helpful to have them for a longer period of time.
It was very difficult for a lot of the students to just pick up the phone and start talking to somebody. So having a little bit of that practice before they would come in was helpful. The first couple of phone calls were a little bit rough sometimes, and having somebody in their corner helping them through it was helpful. But by the end of their 40-hour rotation, they were pretty good at making those calls.
We did also prepare some scripts, so to speak, for them to follow of some of the questions that they had to ask. So it wasn't always just from memory.
It's a great thing having students come through your health department to know what services are available in your community.